From 2010 to 2020, the American Indian Alaskan Native population has increased from 5.2 million to 9.7 million. As this population continues to grow, we as future healthcare workers need to become aware of their history and culture and how this can influence their health. One of the first things to discuss with a patient is how to address them and what terms they choose to be identified as. Indian is a legal term that was set up in treaties between the United States government and Indians. Many tribes may have similarities due to being from the same region. However, there is no clear consensus as to what the people as a whole want to be identified as there is no universal American Indian culture. As such, we need to be sensitive to each individual situation and try to not generalize or stereotype the people and patients that we treat. There has been a history of distrust between American Indians and the United States government and people. One of the first issues was the exposure to new diseases. These can be referred to as the virgin soil epidemic, as many Native people died due to a lack of exposure to these illnesses previously. However, most issues came from formal arrangements. For example, the Fort Laramie Treaty gave a large reservation to the Sioux people in South Dakota. However, when it was discovered that the Black Hills had gold, the lines of these reservations were redrawn to remove this area. Similarly, the harsh assimilation policies that stripped American Indian children of their heritage and culture created feelings of distrust and hatred between the two groups. Some of these policies included military-style boarding schools in which the children would be taught that their culture was inferior. American Indians also experienced forced relocation that adds to this distrust. The Indian Removal Act of 1830 forced many Eastern tribes from their homes to move west. This event is commonly known as the Trail of Tears. With the knowledge of this horrific history, we can approach these patients with sincerity and a willingness to learn about their culture and to create a treatment plan that helps them feel heard and respected. One of the major issues within the American Indian and Alaskan Native culture is having the highest prevalence of diabetes of any United States racial or ethnic group. Some of the causes of this high prevalence within the American Indian and Alaskan Native peoples is having the highest rates of poverty and food insecurity rates. As we become sensitive to their circumstances and strive to increase equality and standards of living, we can start to build feelings of trust with the American Indian and Alaskan Native populations.